Alcidion just listed on the ASX back in February, so Alcidion Group Ltd. Alcidion was formed by the former CEO of the South Australian Health Commission, Ray Blight, and Professor Malcolm Padan. And they really formed the business to resolve the quandaries within the health sector. So healthcare, as we know it, is fundamentally, it's at a breaking point. So in the US last year, they spent 17.8% of GDP on health. So $3.5 trillion on healthcare, but it's going to 37% by 2050. So that's about $54 billion they spent last year on health. But iatrogenic errors, so this is preventable errors in hospitals, were the third largest killer of people. So cardiovascular disease, number one, oncology, number two, and then preventable errors within healthcare. So Alcidion was really formed to resolve this through the development of a health informatics platform. Yeah, so the Miya platform integrates all of the disparate clinical information systems in an acute care hospital, so pathology systems, cardiovascular systems, patient admission systems, emergency department systems, and it binds it all together into one single platform so the physicians can have a look at a holistic view of what's happening with the patients. And then it risk rates that data and notifies the physicians that need to know where the problems are for the patients and what they need to do to resolve that. The way how hospitals manage patients today, depending on how evolved they are technologically, so you start with the traditional manual systems. So these are the clipboards at the end of the bed where people start writing on it. But obviously when you write information down, it's outdated, it's not real time, and it's prone to errors. And so there's this gradual rollout of computerisation across the continuum of health. And that's called the EMR adoption model. So this is a 7-layer model which details the rollout of clinical information systems. Now, by law in the United States, all 8,000 hospitals have to upgrade their clinical IT systems. If they're unsuccessful, by the 1st of January this year, punitive damages start. So they actually get their Medicare and Medicaid reimbursements reduced for non-conformance. If you look at the benefits of running the Alcidion platform, I mean, fundamentally, the business is about trying to drive efficiency in health. It's the healthcare system is just littered with dilemmas. 40% of lab tests that get ordered in a hospital are never actually viewed by anyone. I was saying before that the third largest killer of people are the preventable errors in hospitals. So what Alcidion does is by combining all that information together, it then allows, it provides all the checks and balances to make sure that the correct lab results are being ordered, make sure that when the results come back, they are actually viewed by the right person so things are not missed. And it just streamlines the patient experience from when they arrive into hospital through ED or through inpatient, and just optimises things to make sure they get in and out of that hospital as quickly and as clinically safe as what they can. So at the moment, the Alcidion platform is at paid beta deployments across Western Health. So this is Sunshine, Footscray and Williamstown in Melbourne. It's deployed across Tasmania and also deployed across the Northern Territory. Now, the Alcidion product suite is pretty broad, and different products within that suite are at various stages of their commercialisation. But it's terrific to see that Western Health in Melbourne just signed a $2.35 million memorandum of understanding to deploy the platform into live operation across their 3 campuses. So by this time next year, at the moment we have 11 paid beta deployments at large tertiary hospitals, right? So at Royal Melbourne's ED department, probably one of the most busiest ED departments, the platform is being used continuously. We'd really like to get from those 11 paid beta deployments up to 20 paid commercial sites that transition us to be cash flow positive, and then accelerate that to get to 40 paid deployments, and that'll generate substantially positive EBITDA, and then use the retained earnings to then accelerate the launch into the United States.